So you're here because you want to understand the real risks with psychedelics, yeah.
Mhm.
Not just the scary headlines or maybe some outdated ideas, but what the science actually says. That's what we're going to try and get into today.
Yeah, exactly. We're leaning on the work of Dr. Matthew Johnson, who's, a really prominent researcher in this field, trying to get a clear sense of the actual dangers
Hmm.
and maybe where some perceived dangers aren't quite as significant as people think.
Right. That's the mission here. Cut through the noise, give you folks an evidence-based view. We'll look at how these substances stack up against others, ones we use every day maybe, and kind of tackle some persistent myths. Okay, so
Yeah.
maybe the first big question people have, are psychedelics just inherently dangerous? Especially if we're thinking about them as like medical treatments.
Well, it's a fair question given all the history, right? But I think the perspective Dr. Johnson brings is really key. He points out that, look, every medical treatment, frankly, every psychoactive compound has risks, period. There's no such thing as zero risk. The important thing is understanding what those risks are and, crucially, how you can effectively minimize them.
Okay, that changes the framing quite a bit. It's not just dangerous or
Yeah.
not dangerous, it's about risk management. So if we use that lens, where do psychedelics actually, fall on the harm scale compared to other drugs?
Yeah, and this is where the data starts to get really counterintuitive for some people. Dr. Johnson talks about these studies, numerous ones actually, where experts rank substances, legal, illegal, all kinds, based on harm to the user, harm to society.
And what do those rankings tend to show consistently?
Well, what's striking, and he highlights this, is that the legal status often has very little to do with where a substance lands on that harm ranking. You sort of assume the most illegal drugs are automatically the most harmful, according to experts, but, well, the data doesn't always line up like that.
So if it's not just about legality, what does tend to rank as most harmful in these analyses?
Consistently, you see things like tobacco and alcohol right up there at the top. Legal substances widely available. But in terms of objective harm data, both to individuals and society, they score very, very high.
Wow. Okay, that definitely puts things in perspective. So flipping that then, where did the classic psychedelics usually end up?
They're typically found way down at the lower end of the harm spectrum. Psilocybin mushrooms, LSD. Dr. Johnson specifically knows psilocybin often ranks right at the bottom, like the least harmful overall when you consider all factors. LSD is usually very close to that too. Significantly lower harm scores than many, many legal drugs.
That is, yeah, quite a disconnect from how many people think about them. Really makes you question how those perceptions get formed. All right, let's dig into the specific types of risk then. What about like direct physical danger? Can these things physically harm you?
This is another area where the classic psychedelics are. Well, Dr. Johnson uses the phrase freakishly physically safe,
Hmm.
which is pretty strong language, right? But he means for most people, there just isn't really a known lethal overdose amount for LSD or psilocybin.
Freakishly physically safe. Okay. So why is that? What makes them so different physically?
Well, he explains that the ways other drugs often cause fatal overdoses, like stopping your breathing or causing massive organ damage, because they're so toxic, those mechanisms just don't really apply here. Their actual physiological toxicity, how poisonous they are to the body's systems, is remarkably low. It's just a very different biological interaction.
Okay, that's reassuring from a purely physical angle. But what about addiction? That's a huge concern with any psychoactive substance, surely.
Another really important distinction here. Dr. Johnson is clear.
Hmm.
Classic psychedelics are not considered addictive in the way we normally think about addiction. Now, can they be misused? Sure. People can use them irresponsibly. But they don't cause that compulsive, gotta-have-it-now, drug-seeking behavior that defines addiction to, say, nicotine or heroin or alcohol.
And he had that great line to illustrate it, didn't he?
He did, yeah. He said something like, no one's jonesing for their next shroom fix. It's pretty blunt, but it captures that difference vividly. You don't get the intense physical cravings and withdrawal that drive other addictions.
Right, yeah, you just don't hear about that kind of thing. Okay, now, Dr. Johnson also really emphasizes context, the setting, the support, particularly this idea of a sober guide. Why is that so critical?
Oh, absolutely vital. If you want to understand how to make psychedelic use safer, this is maybe the biggest factor. Having someone there who is trusted, who is sober, who can provide support, it dramatically reduces the chances of things going badly wrong.
How does that work exactly? What does the guide do?
Well, they're an anchor, essentially. If the person starts feeling overwhelmed or scared, the guide is there to offer reassurance, maybe help them reframe things, and crucially, just make sure they don't do anything unsafe impulsively. Dr. Johnson connects this directly to how clinical trials are run. You always have a controlled dose, a safe, comfortable setting, and trained facilitators present. Those aren't just arbitrary rules, they're core safety measures.
Gotcha. So the structure and support are key safety nets.
Okay, what about some of the wilder stories, the urban legends? Dr. Johnson mentioned those too, right?
He did, yeah. He talked about debunking some of these overstatements, as he put it, like that old persistent story about kids on LSD staring at the sun until they go blind.
Oh yeah, I've definitely heard that one. It sounds terrifying. Is there any truth to it?
According to Dr. Johnson, no. He's very clear. There's zero credible evidence that ever actually happened. It's one of those sensational myths that just kind of takes hold and gets repeated, but it doesn't seem to be based in fact. It just fuels fear without real substance. It's so important to call those out, isn't it? Because they really cloud the picture. But that doesn't mean there are no real dangers, does it? He acknowledges that.
Oh, absolutely. He's not saying they're harmless. He talks very directly about bad trips. He knows they aren't super common, statistically speaking, especially in supportive settings, but they can happen. And when they do, they can lead to accidents. Tragically, even fatalities in very rare cases.
How might that happen? If it's not the drug itself killing someone.
It's usually indirect. Someone gets extremely panicked or disoriented. Maybe they feel threatened, and they react impulsively. He gives examples like someone falling from a height trying to escape something they perceive, or wandering into traffic because they're completely unaware of their surroundings. It's the psychological distress leading to dangerous behavior.
Okay, so the risk is less about the substance's direct effect on the body and more about the potential for impaired judgment or panic during the altered state. Now, Dr. Johnson also looked back at some of the really early psychedelic research, didn't he? From like the 50s and 60s. Why was that important to bring up?
Yeah, that historical context is really crucial for understanding how some of the negative perceptions might have formed. He points out that some research back then used methods that were, well, frankly, pretty awful by today's ethical standards. He describes some really concerning stuff, like giving people massive doses of LSD and then just leaving them sometimes restrained in a stark hospital room with zero preparation or support.
Whoa, seriously. That sounds incredibly irresponsible.
Yeah. He mentioned one specific study aiming to treat alcoholism where they apparently strapped people to hospital beds and gave them huge doses, like 800 micrograms of LSD, without properly explaining what would happen or offering any psychological support.
My God, that sounds like setting someone up for an absolutely terrifying experience. No wonder
Yeah.
people might have had reactions that look like psychosis.
That's exactly his point. If you treat someone like they're expected to have a psychotic break, give them an overwhelming dose in a sterile, unsupportive, maybe even frightening environment.
Mm-hmm.
It's hardly surprising they might have a really rough time, maybe even temporarily seem psychotic.
So, the way those early studies were done likely contributed significantly to the fear and the perception of extreme risk.
It certainly seems that way. And he contrasts that sharply with what we know now. Today, the understanding is that in a good setting, with preparation and support, even if someone hits a difficult patch during the experience, the effects will wear off. They'll come back to baseline, they'll be okay.
Sounds like we've come a very long way in understanding how to handle these substances more safely and ethically since those pretty crude early days. Now, he also sort of hinted at the flip side, right? The potential upside.
Yeah, briefly. Although the focus was risk, he did touch on the bigger picture, how psychedelics might actually help us understand mental health better. Maybe even help prevent mental disorders down the line, or at least give us new insights. There's definite promise being explored there.
Right. So while we focused on risk today, it's worth remembering there's this whole other area of active research looking at potential benefits.
Exactly. And, to kind of wrap up his main point on risk, Dr. Johnson basically reiterates, yes, there are real dangers. We shouldn't ignore them. But based on the evidence we have now, those dangers seem to be less common and often less severe than the dangers linked to many other substances we live with every day, both legal and illegal.
That feels like a really important takeaway. Acknowledge the risks, yes, but put them in context. Okay, so let's try and summarize the key points for everyone listening, drawing from Dr. Johnson's analysis.
Yeah. I think point one is, yes, risks exist, but compared to many common substances like alcohol and tobacco, the overall harm profile for classic psychedelics seems relatively low according to expert rankings. Point two, physically, they appear remarkably safe. No known lethal overdoses for most people, and they aren't addictive in the traditional sense.
Right. And then point three is all about context, isn't it? The setting, the support.
Absolutely critical. A safe environment and a sober, trusted guide, like in clinical research settings, dramatically reduce risks. And point four, maybe, is that a lot of the historical fear and those wild stories, they often don't hold up to scrutiny. Bad trips can happen and lead to indirect harm, rarely, but we know much more now about minimizing that risk.
So it really sounds like a lot of the fear narrative might be, well, a bit out of proportion compared to the actual scientific data.
That seems to be a fair assessment of Dr. Johnson's perspective. Which leads us to maybe a final thought for you, the listener. How much do things like legal status or decades-old stories shape how we perceive risk, maybe even more than the hard evidence does? It's maybe worth thinking about. Are there other areas where our sense of what's dangerous might be skewed by things other than just the facts? Something to chew on.